Hello, and welcome to our first episode of Your Health Matters with Marshfield Clinic, where we bring you our medical experts to talk to you about all the things that matter to you most, from cardiac care to cancer treatment, from pediatrics to end of life. My name is Laura Kibbel, and I will be your host. I was born and raised in Marshfield and have over 25 years of working at Marshfield Clinic. I am a nurse by background and spent many years taking care of patients in our hospital. I currently work as an administrator overseeing our clinic departments, and I'm very thrilled to be with you today. Speaking of thrilled, I'm so excited to introduce to you our first guest, our president and CEO of Marshfield Clinic Market at Sanford Health. Please help me welcome Dr. Brian Hoerneman.
Good morning.
Thank you for being with us today. So I know our community is very excited to learn more about Sanford Health and all of the changes that we've been going through. But before we get started on that, would you mind just telling the community a little bit about yourself, where you grew up, your medical journey, and where you're at today?
Sure, I can start with that. And first of all, thanks for having me on, and it's an honor to kick off the program with you. So my background is similar to you, originally from the Marshfield area, and grew up just west of Marshfield between Chile and Lindsay, and then went to school in Madison for undergraduate and in medical school. And in medical school, it was nice because you could do rotations here back at the medical center, so I was able to get some familiarity with the campus and with some of the physicians and other providers here. And so I got to go through anesthesia department, emergency medicine, ENT, a couple other rotations, and it was great. And it was good to get some exposure. And I think that's one of the things that I'm excited about going forward is continuing to have those learners come up through our programs. After medical school, then went out west for a bit, wanted to see the mountains and live out west. So trained at the University of New Mexico in Albuquerque. And then we like being out west. My wife, Tanya, is family medicine. And so we took jobs in Santa Fe for a couple of years, worked out there and liked our practices. And they got a phone call from an emergency room doctor here in Marshfield, Dr. Carpenter, who had been a longtime emergency room doctor, and he was moving on to a new area. And so he had called and was wondering if I wanted a position. It was perfect timing. We were looking at potentially coming back. I had to make a decision of whether or not I was going to commit to a partnership in the ER program that I was at. And we had a baby. We were making a lot of trips back to Wisconsin. We moved back, and it's been great to be back with the health system. It's really been unique to be able to have practice in emergency medicine. We're able to practice at really high level tertiary care, university level care in a small town like Marshfield. So you get the convenience of living in a small town in our rural geography and be able to provide that really high level care. So it's been a great spot to have a career, and certainly looking forward to the next chapter here as we move on with our partnership, and we'll talk about that maybe in a little bit.
Excellent. Thank you. Well, thank you, Dr. Carpenter, for bringing you back to us. So you talked a lot about being an emergency physician. So what drew you to emergency medicine?
Yeah. So I was one of those people in medical school where I kind of liked all the different rotations. So I had a hard time picking which one I liked better. So I like the procedural specialties where you get to do some things with your hands. I like to take care of children. I liked some of the ICU level care. And so I had a hard time deciding what I wanted to do. And emergency medicine has a little bit of each of those. And, a lot of people think emergency medicine, boy, that's, trauma. And that's a piece of it. But a lot of what we see is not necessarily that. It's that other spectrum of things, from pediatric care through taking care of people with shortness of breath and chest pain. It's being able to problem solve. Sometimes you see things that you've never seen before. Even now, I see things that I haven't seen before. And so that part's been stimulating. I also like the fact that when you go into a day, you don't know what you're going to expect. And so you get to be able to have it be new and interesting every day. But yeah, it's been a privilege to be able to practice emergency medicine and actually still like doing so.
Yes. And speaking of that, you, I know for a fact, are an incredibly busy person. You work incredibly long hours. You travel a ton, yet you're still committed to picking up shifts in our ER.
Yeah.
And I know I've had the pleasure of many family members seeing you as a doctor, and very thankful that you're still seeing patients. Why is that important to you to still take care of patients now that you're in this very challenging role as our leading administrator?
Yeah, it absolutely is still a privilege to take care of patients, and I find it rewarding. It's also given me really good context for being a leader in the organization. And so, as leaders, we round and we go to visit the various clinical sites. We talk with providers, we talk with staff. We see what they need, what's going well, where we can work on improvements, and we can get some pretty good information from rounding and making those connections. But there's no substitute quite like being in the workplace, being there, caring for patients, and understanding what the care teams are going through. And so, what are some of the challenges, be it with documentation, or what are some of the workflow things? What are some of the areas for improvement? And so that's been really great to be able to see that firsthand, continuing as a provider, and then be able to be on the other side as a leader and be able to figure out, okay, noticed a few of these things, hearing it in a couple other areas, how can we make some of those changes? So I've enjoyed that. And then as we've had conversations with some of our providers, being able to know where they're coming from, maybe have recently had a clinical interaction with them and having that foundation and having that trust that they understand that I've got that context as well, and am working like them towards the best decision we can for our patients. And so, yeah, it's multifactorial, but yeah, it's still really rewarding to be able to practice.
Yes, that's excellent. I know we've heard many times how much everyone appreciates you still working, and taking care of patients. To what you said, it exactly does, put you in the heart of what not only our doctors, but our nurses and all of our other staff are going through. You're seeing that, the good, the bad, and you have that, firsthand knowledge of what could be improved. And I know that that's something that's highly respected about you as a leader. So thank you for doing that. So, talking about you being a leader, I know it's an incredibly difficult job. There's a lot of responsibility. You get a lot of, the people coming to you of things that aren't going well, fix this. What drew you into leadership? And tell us a little bit about the leadership roles that you've had in the past.
Yeah, I'd like to say that my path to leadership was well thought out and coordinated, and that I had a master plan all the way through, but that was not necessarily the case. I think when I joined the organization 20 years ago, that was not high on my list of things to think about. And fortunately, I have had a number of colleagues, a number of other leaders that have encouraged me to take on leadership positions. So through the years then have initially started taking on some committee and project type work. Then was the chair of emergency medicine for a number of years here in Marshfield. Then had a vice president medical affairs role for the Marshfield campus. And then I had a number of interim roles for a series of years there, where I was the president for the Marshfield campus on an interim basis. I had an interim EVP role, so executive vice president of clinical care delivery for the health system. So that was my first health system type role. Then was interim CEO for the health system, and then for the last 5 months or so, I've been the permanent CEO and president for the Marshfield region, now part of Sanford Health. And so, it's been an interesting journey through leadership, but one that happened, fairly spontaneously, but been a real privilege to be able to be in those roles. And then it's kind of an extension of my emergency medicine work. So similar to emergency medicine, sometimes you don't know what you're going to encounter in a day. You may have an agenda or may have a list of meetings, but the day doesn't always follow that. You get to do some problem solving in the moment. And similar to emergency medicine, it's rewarding. You get to have that impact even more broadly. And that's what I think is kind of neat about leadership is in emergency medicine, you get that really excellent experience of being able to help a patient in that moment. And in leadership, you can extend some of that work even more broadly and have that larger impact. So I've liked that quite a bit, and it's been a great experience to be a leader here at the clinic.
It's wonderful. I know, to what you said, it's some people go to school to go into leadership, and then sometimes leadership finds you. And I think that's absolutely the case, for you, in that over the years, you've been identified, by multiple leaders as just somebody that can do the job. And I know we were all cheering for you and extremely thrilled when you went from interim to permanent, because you have had a tremendous impact on our health system, and very, very excited to see what you can do for us in the future. You brought up Sanford Health, and I know there's a lot of questions in our community about what does Sanford Health mean? What does that mean to us as a community and our healthcare that we receive? So we officially merged with Sanford Health on January 1st of this year. Can you tell us about what this merger means for Marshfield Clinic and for the patients that we serve?
Yeah, absolutely. And it's really been a terrific partnership. So they've been, the Sanford organization has been really great to work with, from the leadership all the way through the different department levels. So that's been a strong start. But overall in healthcare, healthcare is not easy right now, and we're seeing more and more of those collaborations and partnerships develop. And really part of that is the fact that you have benefits of being a larger organization. There are so many areas of specialized knowledge within healthcare. So not only just the clinical care, but a lot of the other functions, be it the technology functions and how complex some of those are, some of the regulatory pieces and understanding that. And it's a challenge for any individual facility to be able to develop that on their own. And if you're a broader, larger organization, you have some of that knowledge and you can share that across a really large geography. So there's definitely benefits to being a broader organization. So we'd been exploring partnerships for the last several years, really to help address some of those challenges we've seen in healthcare. And we're very happy to be able to have that partnership with Sanford close then on January 1st of this year. And then we're excited about what that means for our communities going forward. So our goal overall is to make sure that we are providing access to really great care. And so how are we making sure that we're available in as many communities as we can? How do we provide that really highest quality care that we can, and continue to work on that in an improvement cycle that's never ending? And then how do we do that in a sustainable manner and make sure that, we're here for generations to come, and make sure that we're able to continue to have the organization serve as many people as we can. So the Sanford organization, us partnering together, that absolutely strengthens healthcare in our region. And so that's been exciting. We've heard, or we shared actually, that there's significant investment that comes back into the region, and we're already seeing that. So the dollar amount actually was $500 million that was going to be invested back into the Marshfield market here over the next 5 years. So that's a fantastic investment by the broader organization to help continue to grow resources and access. And then we'll be switching over our electronic medical record over time, so significant investment in that. And we'll see some benefits of moving to Epic as well. So a lot of benefits from that perspective. But overall, it's that strengthening healthcare piece that I'm most excited about.
Yes, I know. I think, we were all nervous. I kind of joke, I've worked my entire career at Marshfield Clinic, but I've worked for 4 different health systems. So it's, now here's another one. What is this going to mean? And truly, I've yet to have a bad experience. I have yet to hear anything negative about the merger. It's going to be difficult, as you said. There's a lot of moving parts to it, but it's incredibly exciting for our health system and our community. So you said, just the growth is exciting. Can you elaborate a little bit more about what you see as, what is some of that excitement around growth? What could our community look forward to that merging with Sanford could help them more in their medical journey?
Yeah, so from the growth perspective, one of the areas that we look forward to is continuing to have additional access to our system. So, looking at our different communities, offering broader array of programs, and making sure that, patients as much as possible can get access to care close to home, and that's still very much what the emphasis is. It's not to have that patient drive to Milwaukee or Madison, but to be able to see their primary care physician in our region, be able to then access specialists if need be. Sanford also has a really strong background in virtual care. So if you think about that, that's allows patients to get care at home or even in a local doctor's office. So you can have a medical assistant that will be able to check vital signs and do some exam, and then work with a provider that may be, hundreds of miles away, even in the broader Sanford organization. So that is really neat. One of the challenges right now in healthcare is around the fact that it's hard to have enough healthcare providers. So there just are not enough physicians and advanced practice clinicians right now. And as a broader organization, we're starting to see some of that sharing of providers. So, and actually it's going both ways. So we have a really strong vascular surgery department here in Marshfield, led by Dr. Weiss, and that group is helping out in some of the Sanford areas where they're short on vascular surgery coverage. And similar, we're talking with the broader organization about getting some coverage back in areas where we're short. So being able to have provider coverage that's consistent, that's really huge, because when you have that gap in providers, then patient can't get in to see or get into the healthcare system and get the care that they need. So that's been terrific as well. And then overall, as I mentioned, we've got that investment that's happening, and that investment back into our facilities and into our campuses, and then looking for those growth areas and a number of those out there too, of how we can better serve our communities.
Excellent. Very exciting stuff ahead for us. So we talked about all the great stuff, but we have to also talk about the challenging stuff. So what keeps you up at night? What makes you worry about healthcare? And you're like, I think one of the wonderful things about you is that not only, are you our CEO and president, but you are invested in this community. It's your friends and family that are coming in every day. And I know that you have that incredible passion and commitment to our community. What keeps you up at night? What makes you worried about our healthcare system?
Yeah, and I think healthcare system's probably the right word there. And healthcare has a lot of challenges right now, and we're seeing it all over. And if you had, said 18 months ago that we'd see hospitals close in our region, I would have said, no, probably not going to happen. We'll figure out ways. But it's not what happened. And just over a year ago, we saw those 2 hospitals close in the Chippewa Valley, in both Eau Claire and Chippewa Falls. And it is just a symptom of how challenging healthcare can be right now. And so there are a number of factors that play into that. I mentioned one of them in the people part of things. And so, people are our most valuable resource in the health system. And we can't provide patient care without really great people, highly trained people that have had the right experience and training to be able to deliver care to our patients. So us having the right mix, the right amount of people, that's a significant challenge. And it's one of those where we need to help develop that pipeline. And similar to my experience, have some training in this system, work as a medical student or work as a medical assistant and get that experience in the system. And then we find that when we have learners experience the health system and work with us, then they tend to stay with us longer term. So a much higher rate of people staying with us. About 40% of our graduates from our medical education program stay with us if you look at it from the residency and fellowship. So that's probably one of our biggest opportunities to continue that pipeline work. More broadly, we're a large portion of our reimbursement comes from governmental payers. Actually, the majority does. And so what happens on that kind of state and national stage from a payer perspective really does matter. And so you hear the conversations about potential changes in Medicaid or Medicare. And those can really impact then what we're able to do and how we're able to deliver care. We actually Medicare and Medicaid doesn't cover the cost of providing the care. And so at the end of the day, it ends up being a math problem, and that we have to figure out how we're going to shift costs from one area to another to be able to continue to provide the care. And so anything that makes that more challenging, or we see negative changes to how those reimbursement rates work, that's significant. I think also for those of us in nonprofit healthcare like Marshfield Clinic, we provide the safety net in a number of our communities. So if you look at all those different communities that we have our hospitals in, we're providing care to patients regardless of their ability to pay. And that's in contrast to some of the for-profit or private equity-backed systems that are coming in, and then they open up a center that is catering to paying patients or patients that have commercial insurance, or they end up catering to those procedures which have higher reimbursement rates. And when you take those components out of a health system that helps comprise that safety net, that makes it much harder to provide the services more broadly. And again, back to a math problem of needing to figure out how we can continue to provide the depth and breadth of care that we do in those circumstances. So that's a short list of things. There are many, I think, challenges in healthcare that we work on every day to address, but those are some of the top ones on my list.
Those are some big ones.
Yeah.
And a lot of work that needs to be done around ensuring that we stay here for 100 more years and beyond that. There's just a lot that we have to think through, and I know that with your leadership and a lot of the people underneath you, we will no doubt get there. So we've talked a lot about you as a leader. Marshfield Clinic, I think in this community is highly respected. We've had many wonderful physicians, many wonderful leaders, board members, administrators. I mean, you name it. There have been exceptional people that have walked through the halls of Marshfield Clinic. What do you want to be remembered as? When you're no longer CEO and president, you're no longer here with us. What do you hope people say about you when they think about, oh yeah, I remember that Dr. Hoerneman?
That's a good one. So I think one of the things that I would be hopeful for is that the positive changes and impacts that we're having be sustainable. And maybe a good example or analogy would be we have an old house. I live in a house that was built in the late 1800s, and yes, you own the house, but you're also a steward for that house. And so you try and make improvements. You try and have it be better than when you found it. And then at some point, you turn it over to somebody else, and hopefully then they can carry that on. So my hope is that, we're seeing so many positive things. We've had a lot of improvements in the last couple years. If you look at it from how we're providing access to our patients. Patients are having an easier time getting in to see us. Patients are getting a better experience now when they call us on the phone. We've done a ton of work around that. Even something like the function of patients being able to get their bills in a timely fashion. We've had progress along those lines. So being able to hardwire a number of those changes and make those sustainable and be able to have that carry on regardless of who's in my seat, I think that's probably the biggest challenge, and what I hope happens long term is that, we're able to continue to have those opportunities. We're able to provide for our patients and our communities. And at the end of the day, that's what it's all about, is really getting that care close to home, especially in a rural geography, and being that premier rural health system in the United States. And that's one of the things that Sanford has long believed in as well. Part of their vision is be that premier rural health system. And so that alignment matches up very well with ours.
Excellent. So I love that. And I think one thing also he'll be remembered for is he's just like a regular person. And you can talk to him about anything, and you're not afraid if he's walking down the hallway, and you usually give him a high five or something. And so that's something I think people will absolutely remember about you, as being somebody that they could talk to about anything and laugh with. So speaking of laughter, I got to have a little fun.
Okay.
All right. So tell me, answer whatever comes to your mind.
All right.
Sweet or salty?
Salty.
Oh, what are we going to go for?
Yeah, I like the savory, so yeah, I could do a little sweet and salty, but salty, I would say, gosh, Gardettos are tough to
Oh,
beat.
yeah. Those are good.
Yeah.
Yes.
What are those pretzels? The Dots pretzels.
Oh, yeah.
Those are pretty good too.
Yeah.
So yeah, I would do that probably over candy.
Excellent. Excellent. Scrubs or business casual?
Yeah, depends on the setting, of course.
Yeah.
Business casual. I don't wear a tie often, so wearing a tie today is
Appreciate that. Thank you.
I make the excuse that's back to my emergency medicine roots, is I
Yes.
typically don't wear a tie in the emergency department. But yeah, generally business casual on a day-to-day basis. When I work in the emergency department, I still get to wear scrubs, and that's nice too. So.
Absolutely. Summer or winter?
Oh boy. Actually, I like both. Actually, that is one of the nice parts about being in Wisconsin, is you get to 4 seasons. And other than kind of the mud season of kind of mid-March through mid-April, the rest of the seasons in Wisconsin are great. So
Yes.
I think as a kid, I struggled more with winter, but now I really like winter, and I like ice fishing, and I like being able to get out. I really like skiing. So winter is great, and then summer is summer. Summer is fantastic. It's fun. It's social. Kids are off and available, and you can travel around and see all the great sights in Wisconsin. So,
Yes.
and
Excellent.
fall, the opportunity to go hunting in the fall and such. That's a great tradition in Wisconsin.
Yes, there is no better state than Wisconsin.
I agree with you.
Just gorgeous.
Yeah.
So ending, I have to ask you a would you rather question then.
All right.
All right.
Here we
So
go.
would you rather catch the biggest muskie in Wisconsin history,
Okay.
or have center front row seats at the Stanley Cup final?
Oh wow. Yeah. Oof. That's a great one.
If you don't know, folks, he loves to fish and he loves hockey.
Yeah,
So-
both those are true. Boy, that'd be I'd have to do a pick 'em on that one. But I would say, fishing overall, because that is part of fishing is just the work you put into it too.
Yeah.
So to get that biggest muskie, you would have to do your 10,000 casts
Yes.
and all that planning and such.
Yes.
So. And some of that is the most fun part of actually things, is being able to think ahead and do that planning and set up your trip and that sort of
Yes.
stuff. So yeah, I think I'd probably go with the muskie, but I would gladly take the other one too.
Well, thank you so much, Dr. Hoerneman, for spending time with us today. We know you're incredibly busy, but this was really helpful information for our community to know what to look forward to. And I know we for sure have a lot of excitement ahead of us, and we'll continue to work very hard to serve our patients. So, and thank you everyone for joining us. Please come back next month. I'm very excited to bring Dr. Moses, one of our leading dermatologists, to talk to us about all things skincare as we get into our summer months and other services that she offers. So until then, be well, my friends.